St. Francis is actually the largest mission in Zambia, and we have 340 beds. And we're classified as a second-level hospital, which means we have specialists in different areas. We have a surgeon, myself, a paediatrician, obs and gynae, and an ophthalmologist. Of the people working here, we have about between 4 and 11 doctors, depending on how many volunteers we've got. The nursing staff is about 100, 110 most of the time. Clinical officers and paramedical officers, usually about 20. And then there's a whole band of ancillary staff in accounts and cleaners and security guards and cooks and all these other people. There are about 200 of them most of the time.
Hi, I'm Mackie Natha. I'm at St. Francis Hospital in Katete, eastern Zambia. And it's Good Friday, the 6th of April 2007. And I'm just about to start my weekend on call, so let's see how it goes. How are you? How old is he? 50. Improving. Decreased temp. Is he eating and drinking? He's improving. Good. His temperature is coming down nicely. Very nice. So this is 15-year-old Danny Malenga, who presented with headache, neck stiffness and vomiting, who was initially thought to have malaria, but then was diagnosed with critical meningitis based on a test in his CSF. So after this, check the CD4 count and check the serum critical antigen. He's improving nevertheless, so that's important. Not talking. What does it take? So 15 and 30. I think, can we do his blood sugar twice a day?
The other machine has got no sticks, that one, they got finished.
Can we borrow some? This is 55-year-old John, who's admitted yesterday with, 2 days ago, with weakness on his right side of his body and some chest pain. He's a known diabetic, insulin dependent, and he really hasn't had his insulin recently. And he's also, for bizarrely, on a drug called chlorpromazine, which calms people down, but I think that's why he's sleeping now. I think he's had a stroke, so he needs to take aspirin. We've stopped his chlorpromazine, checked his blood sugar, and started on insulin. See what happens. They're here, I think. Hi, John. This is John Mazada, who's 12 years old. He came with a painful mass in his right jaw, which we think is a Burkitt's lymphoma. As you can see, it's a classical place to have the tumour. He's got nodes and masses in his liver and kidneys, and a lot of fluid in his abdomen and his legs. We've given him some chemotherapy, and we'll be taking some fluid off his abdomen next week and making him feel a bit more comfortable. Okay. And
I think this will be all right for the sutures.
How are you feeling? Okay? Actually, if you lean over a lot, take this side off first. And then you can just see the stitches, sutures.
Okay.
Come here.
Great scissors.
Slowly.
Oh, that was easy. It's quite shallow.
That's it?
Yeah. Thanks, Jacka.
Morning. This is the special care baby unit.
Premature babies are housed in improvised wooden incubators made in the hospital workshop. Perspex sliding lids are used for temperature control, light bulbs for heating, and a bowl of wet cotton wool for humidity. Simple design helps keep the cockroaches under control.
Good morning. What's this lady's name?
Muna zina lanu ndi mwendani.
Anna Piri.
She's Anna Piri.
Okay. And how old is she?
No, but I'm 78.
1978. So she's 29 years old. And this is the first pregnancy.
Akuti ni mimba number chani?
Yeah,
Number
number 7.
7.
Number 7.
Oh, yeah, and I watch you the number 3.
The first 3 children
Yeah.
are alive.
Okay,
But
the last 3
the others
have died.
have died.
When was she diagnosed HIV positive?
Before this one was born, the other child who died,
Ah,
yes,
Was-
that's when she knew that.
that's she knew. Okay.
She says the husband
Yeah.
doesn't know about her status.
And when was the baby born? I was born
It was born
yesterday. So has the baby had nevirapine yet?
Yes. it
Yeah.
did.
Okay, so both mother and baby have had nevirapine at delivery.
Yes.
And is the baby now taking other medications as well?
Yes, it's only permitting and stopping.
Wonderful.
Is she producing breast milk?
Not yet.
Not yet.
There can be a delay in production of breast milk, but also if there happens not to be any breast milk, she has got a backup here. I know it's difficult when she leaves, but she can feed the child for up to 4 months with lactogen provided by the hospital. Thank you very much.
So there's no... Can I have a fluid chart and also like a brown letter to ask the surgeons to have a look at it?
Its respiratory rate is high, it's got bilateral creps in the lungs, noisy chest. And the abdomen is very, very distended, very, very sort of tympanic. And I'm just querying whether she's also got obstruction. She's also quite septic as well, so very guarded outlook for this patient. So let's give her 1 litre of This is a child with malaria who had lots of malaria in his blood, and was very anemic with a hemoglobin of 5.3. He was transfused 1 unit of blood, and is now on quinine. And he's improving a lot overnight. He improved a lot. His temperature's come down. He's eating well. As you can see, most of the patients here have got malaria, plus or minus pneumonia. It's a very common presentation. I've got it just. Can I have a new piece of paper, please, staff nurse? So this is a patient who came in 2 days ago with burns on the hands. This is Teonia. How did the burns happen? On what? Porridge, hot porridge. So really, food replacement is the mainstay of treatment with antibiotics of burns here, because the patients become secondarily infected, the burns get infected, and they also become very dehydrated, and there's massive fluid loss from the burns.
they are focusing the CD4.
Right.
Yeah, that's why they talk too much about the CD4.
It's just mixing blood.
Correct, it doesn't.
Yeah, there is plasma and there is spark cells. This one is a centrifuge.
But this is the one for testing the CD4 count.
The CD4 count, yes.
Right.
The Malaysia, the biochemistry tests. Albumin, bilirubin, calcium, microbiology.
What's Elvis doing now?
This is a corner for TB, sputum smears.
Okay, take a picture.
Okay.
Good.
Hematology, yeah. Hematocrit centrifuge. This is the micro 60. You have white blood cells, you have red blood cells, hemoglobin, hematocrit, transfusion. Yeah.
This is a...
As you can see, these are our patients. We have a
How old is he? 29. Amadi, my name is Mackie. I'm one of the doctors. Okay. He's a new diagnosis, I see from the notes. Why did he test?
December, that's when we started, feeling nausea and vomiting after feeds.
Is he still vomiting after feeds?
He vomited last night.
Okay.
Then fever.
Okay. What's the main problem for him? What's really bothering him the most?
He feels he's lost weight. And he feels weak.
And is that his wife? Okay. Has she tested? Okay. Breathe in. Slowly. Vamos, chava. Finally, okay, so if before he goes to the ward, if you can go to the lab and for urine test and for blood tests for lab, does he realise he's going to be admitted to the ward?
Pasogolo mubwela lindirani zabwera nikuze naye pasogolo mubwela chonja chapafupi okay tieni hapa because we are assuming that the fracture will heal nicely. She's not in pain as such, but I think she's doing very fine, better than we expected. Pieces of mattress will be nailed into place. Will be used to cover him up nicely like that.
When's the first day of her last period?
I took him for period in
January. 8 September, so she's 5 months, 20 weeks pregnant. This is her third pregnancy.
The seventh one,
so she's had 7 pregnancies and 2 children.
Yeah, this is the seventh.
7 pregnancies, yeah. Does she taking her medications okay? Is she missing any doses? Has she missed anything at all? No? So it's important, obviously, for the baby as well as her to carry on taking the medication well, every day and not missing many doses. If she takes the medication the baby will hopefully be uninfected.
She just said she was told at the PMTCT by the nurse that she will continue with the drugs. That's what she's telling me, so that the infection doesn't affect the baby.
And she mustn't, she must only breastfeed for a short period. Does she understand that and does she accept that?
All about the feeding of the baby. So she found that the only option she can make, according to how she feels, is only breastfeeding up to 6 months. Otherwise, she can't afford buying.
So it's a balance between feeding the baby and also not infecting the baby. So I understand how difficult it is, and I can see 6 months is a very, very brave time good time to do it, and it's very good of her to accept that.